So good evening, everyone. Welcome to the latest edition of Facebook Live. So Optima Clinic has always been at the forefront of ensuring that all of our patients have access to proper care throughout this entire pandemic. We will continue to function even during these tough times. Currently, seem to be going through the third wave, and there are several facilities that patients can access. For example, all of our consultants are available for virtual consultation, either by video call or by audio call. We also have home collection of samples, so you don't need to leave home just to give the tests or collect the reports. And also there's home delivery of medications also available. So if you face problems with respect to any of the medications for arthritis, please do remember to contact Optima Arthritis and Rheumatology Clinic at 9980094600. And I'm sure the nurses who are there on duty from 9 a.m. to 8 p.m. will be glad to help you out. So that said, today's Facebook Live session was about mental health in general. But since the third wave has started off and many of our patients as well as many of our patients' relatives are suffering with COVID, we thought we'll speak specifically about mental health in COVID. So to help us today on understanding this topic, we have two eminent specialists. So we have Dr. Divyashree K. She is a consultant psychiatrist at Optima Clinic as well as Aster CMI. So welcome, Dr. Divya.
Thank you. Thank you for having me.
So we also have Vaishnavi Raghuram. She is a clinical psychologist trained from NIMHANS, and she is joined Optima Clinic recently. So I'd like to thank Dr. Vaishnavi as well and welcome you as well.
Thank you, sir. Thank you, sir. I was trained at JSS myself.
Oh, I'm sorry. So we'll dive right in then. And so while we are discussing all of this, I would request whoever is attending or viewing this session to kindly put their comments or questions in the Facebook Live comment box, and we will be taking up these questions during the session or at the end of the session whenever we get time. So diving right in, Dr. Divya, does COVID affect the brain or affect mental health? COVID infection, the virus itself.
Yes, absolutely. So the virus by itself, it's neurotropic, means it affects the brain. It has an affinity to affect the nerve cells. We know that, one of the symptoms of COVID is loss of smell and loss of taste. Why is that? That is because the virus goes and affects the nerve cells in the brain. And that is the reason which leads to these symptoms. So similarly, when it affects other parts, other nerve cells in the brain, it can lead to many other symptoms. So one, the direct effect of the virus, which can cause a lot of symptoms as the infection is going on. For example, a lot of fatigue. Sometimes people do feel, agitated, confusion, insomnia, difficulty sleeping. So these are all core symptoms of the virus affecting directly the brain. The other thing is, we know that I think a lot of people have already by now heard of the cytokine storm and all that. So we know that inflammation contributes a lot to the symptoms and the disease, and so hence the inflammation of the brain can lead to a lot of mental health problems, so one of which is anxiety and depression. Treatment of COVID by itself, certain medications which are used, like steroids, can cause mental health problems, like decreased sleep and increased activity levels and things like that, which we have seen in the last two waves. So that one, and the effect of having an illness which is which can be lethal. Last time we have seen it's scary. So the effect of having such an illness and having to deal with the stigma of being quarantined and this predicament of having to work from home and all this isolation and things like that, which I think Vaishnavi can elaborate on. So all these, so it's a multifactorial effect which causes, which leads to mental health issues. Yeah.
Okay, so that's interesting. So what you're trying to say is that it's not just a combination of having some kind of infection, but it's actually the virus directly affecting the brain, which can cause many kinds of mental health issues. Right. So in a way, it is a little bit surprising, but not actually, because our brain is also an organ, so it can also get affected, and therefore you can have mental health issues. But interesting to note that nevertheless. So Vaishnavi, what about patients who are not affected with COVID? So the WHO, the World Health Organization, has told that there's a huge tsunami of mental health problems, which is much worse than the wave of COVID. What do they mean by that? I mean, how can the mental health issue be worse than the number of people who are affected with COVID?
Yes, sir. So basically, if we look at it from that perspective, so I would like to say that it's mostly to do with the lack of socialization, the isolation in itself that is causing or maybe triggering a lot of mental health concerns. So it could start from a slight anxiety, or it could be excessive worry about getting infected or spreading the infection. So it could start from there. And also another thing to add for it is also the work from home, right? So that in itself has brought in a lot of changes to the lifestyle in itself. So like all of us, like we are away from physical activity as well in this process. So it's there is no bifurcation or any divide between work and home. So it's all at the same place, and that is also causing added pressure. We feel that we have a lot of time, but still during the end of the day, we have a lot of work undone still. Right? So that is also causing stress. And of course, to do with children, so it is also isolated them. So there is lack of physical activity for children as well. So a lot of concerns are about screen time. A lot of them sticking on to their laptops. It could be for studies, it could be for other purposes also. The screen time has increased a lot. And binge watching certain series, right? Craving for food, binge eating, all of these complaints have also increased. All of it on the start of pandemic again. So these are some of the concerns that are there, and a lot of them are reaching out for help for these concerns, and mainly interpersonal issues have increased. So people are staying at home. Then again, there are a lot of conflicts also that have started at home. So those are also the concerns that they are reaching out for.
Yeah, so that is something which, something which was very strange during the first wave, because when they introduced lockdown and work from home and all of that, people thought that it will be a boon for couples, and people were actually expecting a baby boom after the first lockdown, but it was actually a divorce boom which occurred after the first lockdown. So stressful situations not only increases the stress within a particular person, but obviously that leaks out into the relationship as well. I noticed, Mrs. Vaishnavi, that you said physical activity is limited many times, but physical activity limitation will lead to weight gain. It might lead to other physical problems, but will that have a bearing on mental health as well?
Yes, sir. Yes, definitely. So physical activity is also directly linked to the mood of a person, right? So the more active we are, usually the morning exercises has been proven to like brighten the mood as well. So the lack of physical activity is again something that's going to affect the mood, and that in turn for a long period of time is going to affect the mental health as well. So that's one of the things that we suggest as well. So physical activity is a must.
Okay,
not the rigorous exercises, but at least the simple ones would help.
Okay, so any kind of physical activity or exercises will not only help you with respect to your physical well-being and your physical health, but it will also help you with respect to your mental health and mental well-being. Okay, yes. So that is very important. Dr. Divya, you mentioned that inflammation is a big problem. I mean, we all know that inflammation is a big problem in COVID, and we give steroids for the treatment of inflammation. and that inflammation itself can affect the brain. Now, this is the fact that inflammation itself can affect the brain and cause mood problems is very well known among rheumatology specialists, at least. And we know that patients with rheumatoid arthritis, as well as other diseases, other rheumatological diseases which have a lot of inflammation in them, they are at double the risk of depression and anxiety compared to general population. So would you say that these patients, rheumatology patients who are per se at a higher risk, baseline higher risk, when they are exposed to COVID or when they are exposed to their loved ones, getting infected with COVID and undergoing suffering during these lockdowns and all of that, would you say that they are more predisposed to mental ill health and mental diseases, psychological diseases?
Definitely. So any risk factor which predisposes us to developing mental health issues gets magnified when there is an added stress. So already you are at a higher risk of developing an illness, and on top of that there is another risk. So the world over, everybody is going through a stressful situation, and all of us have different levels or different abilities to manage stress. It depends on our personality or lifestyle, the kind of support we have. On top of that, there are biologically a lot of predisposing factors. Some people are more predisposed to develop anxiety. Some people are more predisposed to develop depression and things like that. So and certain groups of people, not just rheumatological illness, even people who have diabetes, hypertension, any chronic illness for that matter, are definitely more prone or more predisposed to develop mental health issues, especially depression and anxiety.
Okay. So before I go on to the further questions, there have been some comments and questions. So Sudha Ravi asks, what is the speculation about how long the effect of corona will continue? I think what they're meaning is with respect to the long COVID. So there is a syndrome known as long COVID, where people who have recovered from COVID physically continue to feel a lot of other symptoms, and sometimes they tend to have many physical after effects as well, but also psychological after effects. So how long does long COVID last, and what is the advice or treatment that you would suggest in this situation, Dr. Divya?
Yeah, so most of the time, people who have developed long COVID symptoms are usually, suffering from vague aches and pains. Like, they have body pain, they have difficulty sleeping, and a lot of anxiety, palpitations, what we call panic attacks, some dullness in mood, irritability. So it's a cluster of vague symptoms, and they all land up with either a neurologist or or some other specialist who eventually send them to us. So by the time it is detected, I think it's already they would have already passed 2 to 3 months. But once we recognize the problem, and start treating it, from what I have seen, people have recovered within a span of, once they've started treatment and started medication, they start improving in about 2 to 3 weeks, and they go on to get better in about a few months. But definitely that includes not just medication, but also, lifestyle changes and psychological help. So I think long COVID is mostly because of, undetected underlying psychological or psychiatric issues. And once that is treated, they usually get better. A lot of our patients have gotten better. Yeah.
Okay, that is very interesting to know. So Sadanand Pillai, he has the next question. He said that he's recovered from COVID, but he continues to have a lot of sleeplessness. So Dr. Divya, what are the medical things that you would suggest in this kind of situation for sleeplessness? And then we can go to Mrs. Vaishnavi, who can tell us what are the non-medical things that can help patients with respect to sleeplessness.
Right. So insomnia is definitely one of the difficulty sleeping is definitely one of the symptoms of long COVID. People who have recovered do tell us this. Most of the time, what we do is we assess for any primary psychological problem. Sometimes it's anxiety. A lot of times it's depression. So once that is treated, usually sleep problems also settle, but sometimes we do have to give them medications for to help them with sleep for a long duration and slowly wean them off. Pain, anxiety, and a mood disorder. This could be the reason for insomnia in people who recovered from COVID. Yes.
So people who have sleeplessness, you need to search for a psychiatric disease in them.
Yes.
And if there is a psychiatric disease, treating the psychiatric disease itself will be sufficient to take care of the insomnia and the sleeplessness. Okay, so that is quite interesting. Now, you mentioned about other things that can be done to help with respect to sleeplessness. So I want to request Mrs. Vaishnavi whether she can inform that what are the other non-medical things which might help in patients experiencing sleeplessness.
Definitely, sir. I agree with ma'am. So there are a lot of symptoms with regards to anxiety that would come, and then again depression that could cause sleeplessness. So here, one thing that has aggravated because of COVID is the panic during night times. So they wake up with a panic attack and then it doesn't settle soon. And I have seen some of my clients going to emergency because they feel it's a heart ailment or something like on that front. So most of it is because of the panic, also because at night time we are a little anxious that whether we would get help on time or not. So that in itself is an anxiety that's running in the background. So I would suggest first and foremost for all the patients, the sleep hygiene, the first tip would be like do not have the gadgets around you. So be it phone, be it laptop, so scrolling through Facebook or Instagram before going to bed, that in itself could affect the sleep, especially for the ones with insomnia. It is something that prolongs the insomnia again. That's the first tip. The second tip would also be that the atmosphere in which we sleep is also very important. So the room has to be dark. If it is a well-lit room, it is definitely going to affect the sleep. That's one thing. And also, I would encourage, there are a lot of studies also that encourage reading books. So if I'm finding it unable to fall asleep, reading a magazine or a book is also something that is going to like help me sleep as well. And another suggestion which most of the experts give is that do not have the clock in your room if you have issues with sleep. The more you look at the time, the more anxious we get and the more the insomnia prolongs. So keeping the clock away is one of the best tips that has helped. So other than this, there are some of the things like having a warm bath before going to bed, half an hour before going to bed. That is also something that would be helpful. Having a warm glass of milk is also something that's helpful. Or if you are comfortable with a certain meditation practices or certain relaxation exercises, that also could help in inducing sleep as well. So these are some of the non-pharmacological methods, what we call a sleep hygiene again. That could also
I
help.
think getting adequate exercise during the first part of the day, isn't it? Sedentary lifestyle also adds to insomnia, isn't it, Vaishnavi? So I think getting enough exercise so that your brain and body is tired by the time you go to bed, and also all the suggestions that keeping the gadgets away and things like that. Yeah.
So and also avoiding afternoon naps. Like that's also one important thing that is required.
Okay, so these are the non-sort of medical measures, non-medicine measures that we can take to make sure that our sleeplessness, the patient is experiencing sleeplessness either due to COVID or due to other reasons as well. These are the non-medical measures that everybody can implement. That is to keep gadgets away. There should be no light, no sound, no clock, right? And to avoid afternoon sleep and to exercise in the morning. Yoga or meditation, warm bath, and a warm glass of milk before sleeping should also help. So going to further comments, Geeta Ranganath says that the program is nice. Thank you, madam. And Suresh Prabhu, okay, he doesn't have any question. He's just I think he's a fan of Dr. Divya. He says that she's really helpful and she's clarified a lot of doubts. So thank you, Suresh. Manjunath asks how to cure anxiety. So Dr. Divya, is there a cure for anxiety?
Anxiety is a slightly broad term. Lot of diseases, I mean, lot of headings under anxiety. Anxiety by itself is a very negative view of things to come, right? So when you think of future, when you're worried that, oh, what if this goes wrong, that goes wrong, that the style of thinking, negative style of thinking is what we call anxiety. So there can be two types of symptoms. One is physical symptoms. So usually people, when they have a lot of anxiety, they develop, their heart starts beating fast. They continuously sweating, sometimes pain in the back of the head because the muscle is tense. Sometimes the BP, fluctuates. If you go and check your BP during this time, it might be very high. Getting vague headaches, body ache. So these are certain physical, and sweating a lot. These are certain physical symptoms of anxiety. This can come in episodes, like it can become very intense. It can come for a short duration where, like Vaishnavi said, it seems like you're having a heart attack, but it's not really. You go and get yourself tested, it's not really the case. So that is what we call panic attacks, and when you keep getting panic attacks like that, it's a panic disorder. But a low grade anxiety all the time, feeling as if you're on edge, so that is also anxiety. Now we have to, so when you ask me how to cure anxiety, there are two things to do. You have to, one, get assessed whether there is something that like medications that you need to take, because there are certain neurochemical imbalances in the brain which can cause these problems. And second is for you to learn certain exercises, relaxation exercise, how to relax your body, even though your mind is winding up and making you anxious, making you think negative things, how to make your body relax, and learn a different style of thinking, which is what psychologists, which is what Vaishnavi does in her practice daily, how to teach people to take things more, more rationally, and more realistically, rather than thinking of the worst possible outcome. So changing your style of thinking, it's not easy. It has to be done with, like, in consultation with a clinical psychologist. Speak to them on a regular basis and see what is the fault in your style of thinking, which you need to learn, right? So yeah, so in to sum it up, it's both medication and psychological treatment, this is how you cure anxiety.
Thank you, Dr. Divya. Mr. Manjunath, I hope that answered your question. So Ranganatha C.R. Ramaswamy says that the presentation is very nice. Thank you, sir. Faizan asked something about his nose, which I'm not sure, but I would pivot to his third question that he has. He asked, what are the main causes of depression? So, Ms. Vaishnavi, would you like to answer what are the main reasons that patients struggle or suffer with depression?
Sure, sir. So when it comes to depression again, I would like to just mention about what are the brief symptoms of depression and then go to the causes of it. That would be helpful as well. So first and foremost is that most of them think it's just sadness that is associated with depression. So it's not sadness alone. So along with sadness, there is lack of interest in everyday activities. So sometimes there could be like lesser amount of sadness, but deeper lack of interest in activities. Alongside that, there could be tiredness as well. So wherein we don't like not much of physical activity, but still we feel drained out and there's a lot of tiredness that's associated. So alongside that, we might experience disturbances in sleep and appetite. Alongside that, poor concentration, it could be feelings of guilt, helplessness, all of these things. So when we look at the causes for it, again, I would say it is a mixture of both biological causes as well as the psychological or the social causes as well. So on that front, biologically, certain imbalances in the neurotransmitters also could cause depression. So if they have a family history of psychiatric illnesses, that is also a major contributing factor. but not necessarily that everyone who has a family history the next generation would definitely get it. So it always depends upon the stress levels and the life events that have happened. So it goes hand in hand. So I might be at risk, but if I also have an stressful event, then I'm more at risk. So I'll start showing symptoms then. So if you look at the causes, again, it could be stress, it could be interpersonal conflicts for a prolonged period of time. So, and people with poor resilience again. So I know my way of handling things, my problem solving, decision making, if I have certain problems in those phases, that also is something that could trigger depression. So mainly it is the stress, the biological, as well as the familial conflicts, interpersonal issues, work stress, a lot of reasons that could trigger depression again.
So you said biological as well. So I just had one example that I give to patients. So patients with rheumatoid arthritis, I mentioned early on, are at higher risk of developing depression compared to people who do not have rheumatoid arthritis. It is interesting to see that in patients with rheumatoid arthritis, when we use medications like methotrexate to reduce the inflammation or to reduce the rheumatoid arthritis, it has been shown that it helps to reduce their depression as well. It helps to cure their depression as well in those specific patients, in patients with rheumatoid arthritis. So, so there is certain patients in whom it is purely biological, certain patients in whom probably it is purely psychological. But as Mrs. Vaishnavi said, majority of the patients, it's a combination of biology as well as psychology. So I hope that answered your question, Mr. Faizan. So Geeta Ranganath says that very nice explanation by Vaishnavi and Divya. Thank you, Geeta. Rakesh G asked that what is the main reason for sleep apnea? So slightly unrelated, but Dr. Divya, would you want to take this?
Yeah, so when we say sleep apnea, it's actually, having difficulty sleeping, having difficulty breathing when you're asleep. So when we sleep, all our muscles become flabby. We know that, sometimes our mouth is open or, we're drooling when you're sleeping. That's because all our muscles become lax. This also happens to the muscles in our airway. So what happens is the airway can narrow down, and this can lead to, oxygen being cut off from the brain for brief periods of time. So there are certain people who are at a higher risk of developing sleep apnea. So these are people who are obese and who have a short neck.
By airway, you mean the breathing pipe, am I right?
Yes, breathing pipe.
And obese means people who are overweight.
Who are overweight, yes. So overweight people and people who have a short neck. So these are some people who are more predisposed to develop obstructive sleep apnea. Why it is very important is sometimes it goes unnoticed. And how do we suspect OSA? If your partner or if people who in your family complain that you're snoring too much, or if you have episodes where you get up from your bed gasping for air, and you feel very drowsy during the daytime, and sometimes you end up, sleeping off even while you're sitting or watching TV or doing something else. So these are certain signs, symptoms of obstructive sleep apnea. Why is it important? It's important because it can cause long-term effects on your health. It is a risk factor for cardiovascular health, and also you can develop memory problems. Also, you can develop depression. So it is very important to assess this and get it treated. Even though it's slightly off topic, I think it's very important to talk about it because I'm glad somebody brought it up so that everybody can know about it.
So that was Rakesh. I hope it answered our question. So Geeta Ranganatha and Kumar Suman, as well as Sudha Ravi. So their questions seem to be similar. So they're asking, what are the precautions that we can take in this situation to avoid depression or to avoid negative thoughts or just to maintain our mental health? how do we do that? So, Ms. Vaishnavi, would you like to answer?
Yes, sure. So specific to pandemic, there are a few tips that I would want to leave all of them with. So the first thing is, I would say, please identify the triggers. If something is affecting you psychologically as well, do identify the triggers. So most of the triggers that I have come across is that a lot of them do watch news. So it is not just for half an hour or 1 hour, it's throughout the day, it's on. And like it happened in the previous wave also, like constantly checking upon the number of positive cases, the number of deaths. That in itself is a trigger for anxiety and long-term depression as well. So I would say limit the news watching. I wouldn't say turn it off. I would say limit it to specific times in a day. And also alongside this, there are a lot of them who have experienced the compassion fatigue also. Like a lot of our relatives, around people in our surroundings are getting affected, and we just call them up and ask them what things are and try to console them, comfort them. That in turn is also going to affect us if we are doing it too much. So that is also something that needs to be restricted. So alongside that, there are certain tips of self-care that are very, very important. So self-care is something that is not a luxury, it's an essential, it's a necessity is what I would say. So here caring for yourself would be like journaling is one way that could help. So throughout the day, what all your thoughts are, if there is something significant that happened, noting them down, like letting the emotions out then and there is also something that's going to help in the long run. Prayer is also one safe space. So anybody who's interested in prayer also could indulge in 5 to 10 minutes of prayer every day. So here the prayer is not for the well-being of others, it is for your own self. Just having that safe space and praying for yourself, that also is found to help. So recently gratitude journals are something that is most often used. So wherein like expressing gratitude throughout the day. So wherein like if there is a delivery boy who has like delivered food on time, just mentioning it in a journal, like expressing gratitude to him is also something that is going to help. That is also something that's going to prevent or a precautionary measure against certain mental health conditions is what certain journals say. I would also say a spa or a massage or a facial is also an important self-care tip, right? Something to make you feel good, something to make you feel good about yourself is something that's always good for mental health. So it could be dressing up yourself. So being in lockdown, staying at home doesn't mean that we don't have a right to dress up well. So dressing up well is also something that is important. It brightens the mood. It also like makes you feel happy. So these are some of the tips that I would leave with, and some of them are very comfortable with meditation and yoga. So those practices are also very, very important in prevention of mental health issues and sometimes in managing them as well. So these are all certain important tips, self-care tips that I would leave all of them with.
So thank you, Ms. Vaishnavi, for that. So you mentioned about prayer. So with that, in that context, Vinay has asked a very specific question. He says that he has obsessive compulsive disorder and he wants to know whether this can be overcome with just spiritual practices. So Dr. Divya, can you answer that?
Obsessive compulsive disorder is a disorder of the anxiety spectrum. Spiritual practices can help along with medication and psychological therapy. There is very specific psychological therapy called cognitive behavior therapy for obsessive compulsive disorder. Sometimes prayer can be a kind of compulsion in obsessive compulsive disorder. So I wouldn't say whether without knowing straight away what kind of obsession or compulsion you're dealing with, I wouldn't advise you to just go ahead and pray. Please get yourself assessed and seek, if you're prescribed medication or if you're advised therapy, go ahead and take it. Prayer can definitely help. Like Vaishnavi said, it's one of the coping methods, but it cannot be the only solution for OCD.
So you said that, you said that you should seek help. So can you just list out maybe 4 or 5 important, sort of red flags or important things that when these happen, then people should definitely seek help?
Yes, I think this is the most important message that I would want to give through this talk, that because over the last 2 waves, what we have learned is that patients are either not able to understand what is going on with them and that they need mental health help, or they are very reluctant to seek help when they're referred, and that delays recovery. So certain things that are red flags in and which should prompt you from going and seeing a doctor, a mental health doctor, is one, low mood, continuous low mood throughout the day, low energy levels, coupled with low energy levels, crying spells for no reason, lack of interest in things that you were interested in, sometimes irritability, you snap at things very easily. People around you have said that you seem to be more irritable and on the edge nowadays, things like that, which keeps going on for a few days. Difficulty sleeping, lack of interest in eating, lack of appetite, negative thoughts, thinking of things that are, that can go wrong. Most of the time, a lot of us have negative thoughts, but if they preoccupy your consciousness, it's there for most of the day. And if all these symptoms prevent you from doing your day-to-day activities, like, you're not able to work because of this, you're not able to interact with your family members, you're not able to socialize with your friends, or you've lost interest in doing these things because of these symptoms. So this is one group of symptom. The other is difficult, aches and pains which are unexplainable. You've gone to multiple doctors and they've said nothing is wrong with you, but you seem to be having difficulty with, body aches and fatigue and difficulty sleeping. Also, sudden episodes where suddenly your heart starts racing for no reason and you seem to be short of breath and you feel as if you're going to collapse. Sometimes some people have dizziness, some people have tingling numbness in their hands, and so these kind of intense episodes, and you've gone to a cardiologist and they have said nothing is wrong and they've referred you to a psychiatrist or a psychologist. So these are all symptoms of panic attack, depression, anxiety, which means that you need to go and seek help with medication and treatment, and with psychological help. It vanishes, it brilliantly helps. So it's not that difficult. It's not that and some people think if you go to a psychiatrist and start taking medication, you can never stop. None of that are true. Maybe we can talk about the myths surrounding psychiatric medications later on, but it's not true. Please seek help if you have these symptoms.
So you mentioned that many people don't seek help because of the stigma. So what would you mention to them? To help them overcome the stigma, what would you want to directly tell a patient who, let's say, who needs your consultation, or who needs the consultation of a mental health specialist, but is not ready to take that consultation because of stigma? He or she is worried, what will others think, what will this think? So what would you say to that person?
Yeah, so just like all other organs of our body, can develop can develop any kind of disease. Like you can develop hepatitis, you can develop an infection, develop liver disease, you can develop heart disease. There we have no problems rushing to a doctor. But so the mind is in the brain, and brain is also an organ. And so when there is certain imbalances, where there are certain chemical imbalances, which can happen due to stress, the brain can also affect the way we think. The problems in the brain can affect the way we think, the way we feel. So I think the stigma is usually because people feel that it's a character flaw. It is a it's a sign of weakness. Depression is a sign of weakness, or anxiety is because you just don't know how to be strong, or which is all not true. We know a lot of smart, powerful, famous people who have undergone depression, like Abraham Lincoln, for that matter. Apparently he was depressed, but he led the country into a civil war, and I can't think of a stronger or braver person. So what I want to say is that it is having any kind of mental illness is not a character flaw. It's not a sign of weakness. It is your brain imbalance in the chemicals in your brain, and which needs to be treated. And the myth that once you're on medication you'll always be on medication is not at all true. So these are some things that I would like to tell people. And once you improve your mental health, your quality of life gets better. Your physical illnesses get better. For example, people who have heart disease and depression, if your depression is treated, the outcome of your heart disease is much better. If your depression or anxiety is treated, your outcome of rheumatological illness, the pain is much better, right? So your outcome, the quality of life is much better. Your people around you are much happier. You're better at work. You're better with your family. So I think it's something that everybody needs to know, that it's not like before where people used to think that it's the God's curse or anything like that. It's not really that. It's just like any other organ, that the brain has certain imbalances which needs to be corrected.
So when I think about stigma, there are two tragic example which comes to mind is like in the same industry, if you see two outsiders. So one was Deepika Padukone, who had entered Bollywood. So she also had depression, but she was quite open about it. She went through her struggles. She did not succumb to the stigma. She did not this thing, and she made it. She was cured of her depression, and she's doing fine. On the other hand, Sushant Singh Rajput, unfortunately, he could not overcome the stigma. He could not take medications properly, and because of that, we lost such a talented actor who many people loved so much, and really felt his loss. So there are many other questions, but I think we've already gone way past the time. So Dr. Divya was mentioning about how outcomes are better if you treat your psychological problems. So in that context, I would also like to mention that if you have certain mental health diseases or mental health problems like depression or schizophrenia, and suppose you develop COVID-19, you are more likely to land up with severe COVID, or more likely to land up on a ventilator compared to a person who does not have a mental health problem. So not only should you treat your mental health problem so that you are well mentally, but also you should treat your mental health problem so that you're well physically. So just like the body can affect the brain can also affect the body. So since the COVID-19 wave is going on, one way in which you can protect yourself from having bad problems due to COVID is apart from exercising and maintaining a good weight and taking care to make sure that your sugar and blood pressure is under control, is also, if you have any kind of mental health problems, then please do seek help and take treatment. So one last question, there are many other questions, but because of lack of time, we will have to, probably we can answer them in the comment section. I'm apologize, and I'm very sorry that we are not able to take up all the questions. So one last question that we can take up before closing is, Vinay asks that who should he meet for a mental health problem? Should he meet a psychologist or a psychiatrist, and what is the difference?
Okay, so usually if you have a mental health problem, you can meet a psychiatrist or a psychologist who will refer to each other in case, for example, if you see a psychologist and they feel that you will do well with medication, then they will refer you to a psychiatrist. And if you see a psychiatrist, then, and if they feel that you will also need, or you might benefit only with the psychological help, then they will refer you to a psychologist. So it doesn't matter, just access some mental health professional, and they will refer you to whoever appropriately.
So it's a team approach, basically.
Yes.
So ideally, you should go to a center where there is a team of psychiatrists and psychologists who can work together and ensure that you get the best care possible from the correct specialist. So Optima is one place where we have Dr. Divya as well as two qualified psychologists. So that is one place that definitely you can consider. So with that, I think we have come to the end of the session and we can definitely close that. But before we do that, we usually have these Facebook Live sessions to educate the lay public as well as our patients about various aspects of health. But since the third wave is going on, we will be having a special session this Saturday, that is the 15th of Jan, on Omicron, as well as preventive dose or booster dose, whether rheumatology patients have to take the third dose or not. So I would request all the patients to please log in again on Saturday at the same time at around 8 p.m. On Facebook, and we will be able to answer all your questions with respect to COVID-19, Omicron, third dose, as well as vaccination of teenagers if you have any doubts with respect to vaccine.